Hello, good evening everyone. My name is Richard Bogle and I'm one of the cardiologists here at Epsom and Helier Trust. And I'd just like to thank Matthew and Rachel for inviting me to speak to you this evening. And I thought we'd kind of go through the keyhole and have a peep behind the scenes at the cardiology department right across the trust at Epsom and St Helier and beyond. But really, to start with, I'd like to tell you what I think our values are in cardiology about what we're trying to achieve for our patients. Because the most important thing is the patient, their care and their treatment. And that's what should drive all of the developments and all of the services that we're trying to provide. So we like to say that our aim is to provide rapid access. Nobody wants to wait to be seen, to see a consultant if they're ill. Consultant-led services, so patients get the highest possible level of expertise in their assessment, with those services delivered as locally as possible, so people don't have to travel a long way, but the quality should be high, not just judged by us, but judged by external peer review, and that we're giving you treatment of the heart. So what is cardiology? What do we actually do? Well, it's the study of the heart, and our patients come in all shapes and sizes, from 16 years of age to 105 years of age at the last count. One of the most common diseases that we treat is coronary heart disease. That's where narrowings of the arteries occur that lead to chest pain and sometimes breathlessness. But we also see patients with valve disease. Many patients, as they get older, develop degeneration of their heart valves and the valves begin to narrow, and that leads again to symptoms of pain in the chest and shortness of breath. In younger patients, and older as well, we often see arrhythmias, so the heart rhythm changes and patients may suddenly suffer with palpitations or dizziness. A lot of our work is connected with arrhythmias such as atrial fibrillation, which some people in this room may indeed have. We also deal with the heart muscle. It's a pump, and sometimes it goes wrong and it doesn't work properly, and patients develop a syndrome which we call heart failure. The heart doesn't work properly, and those patients may again present with breathlessness and swelling of the limbs. We also see lots of patients with high blood pressure because that's an incredibly common disease, and although most of those patients are treated by their general practitioner, we'll see the more difficult and perhaps younger patients with that condition. And we see also a small number of patients with congenital heart disease, mainly who've been looked after previously by paediatric cardiologists, but reach adult life and therefore need specialist follow-up. And we do all of this work in a huge number of different environments, ranging from specialist clinics to assess patients, for example, with chest pain, and our rapid access chest pain clinic operates on a daily basis, either at the Epsom or the St Helier site, and that offers patients a rapid assessment who've got chest pain, which is believed to be coming from the heart, so symptoms of angina. And we see patients within 2 weeks, and all patients are seen within that time, and then investigated on the day with either an exercise test or other investigations, and then referred on as appropriate. And about a third of those patients turn out to have something wrong with their heart, so we're able to reassure the other 2/3. We see a lot of patients with arrhythmia, and we're lucky to have arrhythmia nurse specialists to support our service. Originally funded from the British Heart Foundation, these 2 nurse specialists are able to offer a rapid access atrial fibrillation clinic and cardioversion to correct abnormal heart rhythms. For patients with heart failure, once the diagnosis has been made, those patients often require the modification of complex medications which need to be gradually increased in dose. And we are fortunate to have 4 heart failure nurse specialists, 1 based within the trust and the other 3 based out into the community, who can help manage those patients. Here at Epsom, a new development is for actually to have a joint cardiac and cardiothoracic clinic with a consultant cardiothoracic surgeon, Mohammed Amrani, coming from Harefield Hospital to see Surrey patients here at Epsom who need operations, to save those patients having to travel all the way into Harefield Hospital, which is a considerable distance. So the only time they have to go to that hospital is for their operation, not for all the pre-operative assessments. We're very fortunate to have a pacing service where pacemakers are implanted here at Epsom, and we have follow-up in a pacemaker clinic, and also a new development, our lead technician CRP, as a defibrillator clinic to assess and monitor those patients with these complex devices which have been implanted. We also have direct access services, so general practitioners who suspect heart disease can refer directly into the department, bypassing the need to see a doctor, but for specialist tests such as an echocardiogram, which is an ultrasound scan of the heart, or an ECG. And we also have specialist hypertension clinics to assess those patients with difficult to control blood pressure. Now, one very important part of the department's work is the provision of cardiac investigations. Anyone who's had any exposure to cardiology or a cardiologist will know that cardiologists like doing tests to investigate the diseases which we believe. And the reason for that is that some of these conditions cannot be found by just simply examining the patient. Someone who's got a narrowed coronary artery, you can't hear or see that. You can only hear the story the patient's got to tell you, and then you may need to go on and investigate that by performing an electrocardiogram, and we perform over 12,000 of those a year across the trust. We may want to stress the heart because most cardiac patients' symptoms come on when they exercise, not at rest. So by making the patient or asking the patient to walk on an exercise treadmill test while I'm monitoring the ECG, we're able to detect abnormalities which might suggest coronary artery disease. We're able to do other investigations like tilt testing to check for causes of collapse and blackouts. Pacing checks I've told you about, and also we have access to specialist monitoring equipment whereby if patients are complaining of palpitations which occur intermittently, so an abnormal sensation of the heartbeat, we're able to fit special monitors that they can wear outside of the hospital to monitor the patient for up to heart rhythm for up to a week. We're then able to analyse that information and see if we can find out what cardiac abnormalities of rhythm are causing their symptoms. And finally, we can do blood pressure monitoring to check what a patient's blood pressure is like when they're outside in their home environment. Very important because blood pressure often goes up when the patient comes to hospital. But the most important part of cardiology is imaging. Seeing the heart is vital for us to be able to understand how the heart is functioning and what might be wrong with, for example, the blood supply to the heart. So cardiology does a huge number of cardiac imaging investigations, and there have been considerable new developments over the last few years which have allowed us to expand the provision of imaging services locally. We do nearly 8,000 echocardiograms a year across the trust, and that's an increase from about 5,000 5 years ago. And that enables us to see the heart moving, and it also enables us to check the cardiac valves and see if there are blockages or narrowings or leakages in those valves. One new development is to offer patients transesophageal echocardiography. Before, patients would have had to travel to St George's. Now we're able to offer this service locally, both here at Epsom with my colleague Dr. Dariani and myself at St Helier Hospital. And that involves putting a telescope down into the gullet and imaging the heart from the back, and you get amazingly clear pictures of the heart structure and function, and that's vital for assessing patients who've got certain types of valve leakage. We do nuclear perfusion scanning to check for blockages of the arteries with our colleague in radiology, Dr. Parthipan, and we're able to take pictures of the heart arteries using CT coronary angiography, both at Epsom and St Helier, with our colleague, Dr. Key. And this is a very important new technology because it allows us to see the tiny arteries that supply blood to the heart. And in the old days, we would have had to do an invasive test, pass a catheter up inside the patient to the heart in order to get that information. So we can do that non-invasively without exposing the patient to increased risk of having to do an invasive test where a needle goes into the heart. We're also able to offer cardiovascular MRI scanning locally here at Epsom, and this gives us amazingly detailed quality imaging to look at heart muscle disease. Of course, we still have to send our patients elsewhere for invasive cardiac procedures such as an angiogram or an angioplasty, but all of our consultants are linked either to St George's or the Royal Brompton Hospital or St Peter's Hospital. So if you see a consultant cardiologist, for example at St Helier, it will be the same doctor who does your angiogram at St George's Hospital. It's just a different location, but there is excellent continuity of care within the cardiology department. And of course we offer these services not just in the hospital here at Epsom and St Helier, but we've extended our network out into the community. We've had the opening of the Jubilee Health Centre in Wallington this year, and I'm very proud to announce that one of my clinics will be transferring there from next week, and that will be nice for patients who live in the Wallington end of the patch. so that they won't have to travel so far, and I believe parking will be a lot easier, which is a great thing. We also have consultants from Epsom going out to Shadbolt Park Surgery and also Cobham Health Centre, again bringing that expertise closer to the patient's home in those areas. And also it provides an excellent working relationship between the consultants and the general practitioners. It's far easier for a GP to just pop in when we're in one of these surgeries and ask us a question. That may even save the patient needing to be referred into the hospital environment. Of course, cardiology supports lots of other departments in the hospital, whether that's the stroke services, whether it's the renal department at St Helier Hospital, whether that's anaesthetics and ITU, the respiratory department, or the A&E and acute medicine unit and care of the elderly. Because general medicine, approximately 30% of patients admitted to hospital with a medical problem, that will have a cardiological element to it. And those departments need to access our services to support their work and to make sure that the patients are investigated in an appropriate way and quickly so that they are not delayed in their discharge. Now, we've grown considerably. It's sometimes hard to see that when you're working in a department, but when you look back over the last 5 years, the number of full-time consultant cardiologists in this trust has gone from 2 to 5. The number of arrhythmia nurses has gone from none to 2. More heart failure nurses, a tripling in the size of the rapid access chest pain clinic staff, a doubling in the size of junior cardiology doctors providing inpatient services, and a huge 6-fold increase in the accredited staff performing echocardiography. The British Society of Echocardiography is our professional society that regulate cardiac ultrasound, and they visited our department 2 years ago and gave us an accreditation mark, which only 30 hospitals in the United Kingdom have. And that marks us out as providing a high-quality ultrasound service, which has been externally peer-reviewed. And that service is delivered by highly qualified staff, and that shows by the number of staff that we have put through the accreditation process. I spoke earlier about some of the tests, and you can see on this slide how we've grown in terms of the activity that we've produced and the numbers of investigations that we do. A huge increase in echocardiography, an increase in lung function tests, and that was mainly driven by appointment of new respiratory consultants here at Epsom Hospital. Pacing checks, over twice as many of those performed. Previously, those patients would all have had to have travelled up to St George's Hospital for their pacing check. That not required, and then the defibrillator checks the same, and more blood pressure monitors. But one thing has gone down, and you might be wondering, why are we doing less exercise tests? What's that all about? Well, the reason is we're able to now provide better imaging tests for those patients who we would have put on the treadmill before, but national guidelines changed, and they suggested that there might be better ways of imaging the heart. And so we're able to provide stress echocardiography, taking pictures of the heart while making the heart work harder and faster, as well as nuclear scanning and also CT angiography. So those are all very, very important developments, and they are as a result of working between departments of cardiology and radiology to provide those services. We believe that partnership working is very important in cardiology, and we work with our commissioners to try and provide the services that they want, both the Sutton CCG and also the local Epsom CCG. We of course work with the ambulance service because we know that some of our patients are probably better off not coming to these hospitals. Someone who's having an acute heart attack needs to go to a catheterisation laboratory in a heart attack centre straight away. They don't need to come to Epsom or St Helier Hospital and then go there. And we believe that's the right way that those patients should be managed. We've got good cross-site working with St Peter's Hospital with access to invasive services there. And as I mentioned, consultants coming from Harefield Hospital, patients going to the Royal Brompton Hospital and also St George's. So there's a huge network which supports the work that we do in the department. Now we're committed to training and teaching. I told you about our BSE accredited sonographers, and that's a really important part which underpins the work of our department. But we're also training tomorrow's cardiologists and tomorrow's junior doctors by having medical students attached to our team, supported by a clinical teaching fellow, and also registrars in cardiology. These are training doctors, both on the Epsom and St Helier sites, that are progressing on their pathway to provide the consultants of tomorrow. And finally, we're doing cutting-edge treatments and research. Last year we developed and pioneered a new treatment for resistant high blood pressure, in which the arteries supply to the kidney is changed by passing a small catheter into the artery and destroying some of the tiny nerves that supply the artery to the kidney with blood, and that allows the blood pressure to fall. And this is a novel treatment which is only offered in a handful of hospitals in the United Kingdom and around the world. And that's been pioneering treatment, and we did one of the first cases in the middle part of last year. And we're also doing important clinical trials in heart failure and also in hypertension. So we're trying to do cutting-edge research as well as deliver important clinical services to patients. But what of the future? We don't want to rest on our laurels. We have, over the last 5 years, tried to build up our non-invasive services, and we've reached a point now where we're able to offer virtually all of the services that we need in that type of cardiology. And what we look to the future of with the developments that hopefully will happen with the hospitals in the next few years is to develop local invasive services, so we can bring back invasive angiography and more pacing to our patients locally, so they don't have to travel as far for those services. I'll be around at the end, and I'm very happy to answer any questions that you've got and to discuss anything further that you'd like. Thank you very much for your attention.